Welcome all. Welcome to this crucial M Excellence update, and that is actually going to determine the way the postgraduate entrance is going to shape up in the upcoming years in India. And today the cabinet actually approved the National Medical Commission, and it is going to replace the NCI. This is the first important point. National Medical Commission is going to replace MCI. It got the cabinet approval. They're only few years away. It's going to replace the MCI. This is number one. Number two, the final year MBBS examination now is going to be known as National Exit Test, and it is going to serve as a licensate examination. So we understand that from the final year examination, it is the final year examination. The question many times came that whether there is going to be practical and only theory. As per my concern, that it is very difficult to take practical examination of 2 lakh plus students. How can you actually compare practical examination score of one medical college in south and one medical college in north? There has to be standardized procedure. It cannot be done like this. But what will be there after the final year examination? You will have to sit for the next examination. That is for certain. And important question is that whether it is this year or the next year, and in all probability it is going to be the next year. Number 3, the FMG is going to be replaced. FMG is going to be replaced because it is going to be one stent licensate examination. Again, the concern is whether it is going to be this year or next year. In all probability, again, it is going to be next year. If there is a minuscule more chances in actually scrapping of FMG, this can be this year, this winter, but in all probability, it is also going to be the next year. One important information that have been given in this particular update, that Institute of National Importance like AIIMS, PGI, JIPMER and NEET, you actually have to get a next score. Now we don't know it is going to be one-step examination or two-step examination, because AIIMS is very particular about the quality of question they will ask. They won't compromise on that. It can well be one-step examination or can be two-step examination like IIT Main and Advanced. And one good thing, if the persons who actually want to study in the private medical colleges, there will be reduction in the fees, at least in the 50% of the seats. There will be reduction in the fees. That is good for those persons who are looking forward to study their at least the clinical seats in a private medical colleges. This particular examination is not only going to be important for one individual who is going to be doctor, but also for the institution itself. Like the IIMs, they actually have to live up to their reputation. IIT, you have to know that IIT and IIM have to hold on their brand values. Right now, the Medical Assessment and Rating Board actually ensures the medical colleges also have to live up to their brand values. We all know there is a tremendous scope of foreign patients coming to India for treatment. Actually, it is happening, but they want to take it to the large scale. They are going to give a rating of all the medical colleges and the institutes where actually ensuring the post-graduation studies and conducting the post-graduation studies or super specialty studies. They are going to give them the rating, and on the basis of that, the student will have the chance to pick up their coveted college and the discipline. This is very good sign. This is a medical tourism, and this is a tremendous business venture, and this can be the upcoming thing, which is a positive thing for doctors. At least they will earn something respectively on the global standard, the Indian doctors actually till now considered as the best across the globe. But right now, after this MARB rating process, we will know which colleges are better and which colleges are not that better. We have to actually pull their shots to become better. And this is actually this competition which will ensure that not only the colleges are getting better, the patients are getting better quality treatment, and that is very, very important. The other part of this update, which are not that important for persons who are looking to this, but one important thing, they will try that NMCA and respective boards will ensure dynamic and modern education environment, decreasing the emphasis on physical infrastructure, achieving the norms of global standard and an effective grievance redressal mechanism. So what it states, it is not going to put emphasis on the physical infrastructure. There will not be a specific criteria of 100 acre for setting up a medical colleges, which Dr. Devi Shetty has said many times. It can be much lesser area which can start a medical college. This is awesome process. There are many hospitals, they can actually start their medical colleges, and what they are very particular, the achieving the norms of global standard is a very, very important point, because global standard, if the doctor and the infrastructure is of global standard, then the patient will come to that particular hospital only, and then only the medical tourism will take place, and there will be effective grievance redressal redressal mechanism, and that is why there will be hopefully lack of less incidents of visiting the doctors, and that is again a very, very positive sign. So hope you like this particular presentation and you understand that there are far lesser chances of having scrapping of NEET examination this time, or having the next examination this time, because the whole process of new pattern questions, and you have to actually have totally new logistics to set that up in the upcoming 6 months, when one particular batch is also going to write the examination, their final year examination. So all these changes will not be done in a hurry. They most probably will give them at least 1 year time. So hopefully these particular changes are going to happen in 1 year time. And if you have any queries after this regarding these changes, you write to our Facebook pages message boxes. If you have any queries regarding that, we will answer it within 72 hours. Thank you for support. Thank for your support, and again we are really grateful to you for your absolute support, continuous support, and thank you.